Welcome to Asian Watch. Today, we were talking about a dangerous disease that can hide behind a common symptom in small children: a fever. A child's fever is something every parent has dealt with. It's often seen as a routine part of growing up, a sign the body is fighting off a simple cold or infection. But what if that fever isn't so simple? What if it's a warning sign for something far more serious, something quietly attacking the heart? This is the reality of Kawasaki disease. It often starts with a child who is burning with a persistent fever. So, what exactly is Kawasaki disease? It's a rare illness that primarily affects children under the age of 5. The condition involves inflammation of the walls of medium-sized arteries throughout the body. The most significant concern is its effect on the coronary arteries, which are the vessels that supply blood to the heart muscle. When these arteries become inflamed, it can lead to serious heart problems down the road. The exact cause of Kawasaki disease is still a mystery. Scientists believe it might be an abnormal immune response to an infection or another environmental trigger, but a specific cause hasn't been identified yet. It's not contagious, so you don't have to worry about it spreading from one child to another. While it can affect children of any race or ethnicity, it's more common in children of Asian and Pacific Islander descent. Recognizing the symptoms of Kawasaki disease early is absolutely critical for effective treatment and preventing long-term complications. The disease typically presents in phases. The first phase, which can last up to 2 weeks, is marked by a high fever, usually above 102.2 degrees Fahrenheit or 39 degrees Celsius, that lasts for at least 5 days. This persistent fever is a key sign and often doesn't respond well to standard fever reducers like acetaminophen or ibuprofen. Alongside the fever, other distinct symptoms will appear. A child might develop a rash on the main part of their body and in the groin area. They'll likely have extremely red eyes, but without the thick discharge you'd see with pink eye. You might also notice very red, swollen and cracked lips, and an extremely red, swollen tongue, often called a strawberry tongue. Another telltale sign is swollen, red skin on the palms of the hands and the soles of the feet. They might also have swollen lymph nodes in their neck. A child with Kawasaki disease will typically be very irritable, fussy, and uncomfortable. These symptoms can be distressing to see, but identifying them is the first step toward getting help. After the initial phase, a child enters the second, or subacute phase. This usually begins around 2 weeks after the fever started. During this time, the fever, rash, and swollen lymph nodes will likely resolve. However, this is when other symptoms may appear, and it's a critical period for potential heart complications. The most characteristic sign of this phase is peeling skin on the hands and feet, particularly around the tips of the fingers and toes, often in large sheets. The child may also experience joint pain, diarrhea, vomiting, or abdominal pain. Although the child might seem to be getting better because the fever is gone, this is often when the inflammation of the coronary arteries can develop or worsen. That's why follow-up care is so important, even after the initial symptoms subside. The third and final phase is the convalescent phase, where the child slowly begins to recover. This phase can last for several weeks until all signs of illness are gone and their energy levels return to normal. However, it can take up to 8 weeks for blood test results to normalize. So, if you suspect your child might have Kawasaki disease, what should you do? The answer is simple. See a doctor immediately. This is not a wait-and-see kind of illness. Early diagnosis and treatment are essential to prevent potential heart damage. A doctor will typically diagnose Kawasaki disease based on a physical exam and the child's symptoms. There's no single specific test for it. Instead, doctors look for the hallmark signs, like a prolonged high fever, plus several of the other key symptoms we discussed. They may also order tests to rule out other conditions like scarlet fever, measles, or an allergic reaction. These tests can include blood tests to check for signs of inflammation, a high white blood cell count, and anemia. An electrocardiogram or EKG might be done to check the heart's rhythm, and an echocardiogram, which is an ultrasound of the heart, is crucial. The echocardiogram allows doctors to see the coronary arteries and check for any swelling, aneurysms, or other abnormalities. This test is vital for both diagnosis and for monitoring the heart throughout treatment and recovery. Now, let's talk about treatment. The good news is that Kawasaki disease is treatable, and most children recover completely without any lasting problems, especially when it's caught early. The standard treatment is administered in a hospital setting. It consists of a high dose of gamma globulin, also known as intravenous immunoglobulin or IVIG. This is a substance made from human blood plasma that contains a concentration of antibodies. It's given through an IV drip over several hours. IVIG helps to reduce the inflammation throughout the body, particularly in the blood vessels. This single dose of IVIG is often enough to bring down the fever and resolve other symptoms within 36 hours. In addition to IVIG, children are usually given high doses of aspirin. This might sound strange, as aspirin is typically not recommended for children due to the risk of Reye's syndrome. However, under medical supervision for Kawasaki disease, aspirin is used for its anti-inflammatory and antiplatelet effects. It helps reduce the fever and inflammation, and also prevents blood clots from forming in the inflamed arteries. Once the fever has been gone for a few days, the doctor will likely lower the dose of aspirin. The child will then continue to take a low dose of aspirin for at least 6 to 8 weeks, or sometimes longer, if there are coronary artery abnormalities. This helps to keep the blood thin and prevent clots while the arteries heal. Life after a Kawasaki disease diagnosis involves careful follow-up, especially concerning the heart. After being discharged from the hospital, your child will need to see a pediatric cardiologist, a doctor who specializes in children's heart conditions. They will have follow-up echocardiograms to monitor their coronary arteries. The first one is usually done a couple of weeks after treatment, and another one around 6 to 8 weeks later. If these initial echocardiograms are normal, the long-term outlook is excellent, and the child can usually return to all normal activities without restrictions. For the small percentage of children who do develop coronary artery problems like aneurysms, the follow-up care will be more intensive. They will need to continue taking low-dose aspirin or other blood-thinning medications long-term to prevent blood clots. They'll also need regular checkups and echocardiograms throughout their childhood and possibly into adulthood to monitor their heart health. In very rare and severe cases, further medical procedures like a cardiac catheterization or even bypass surgery might be necessary. But it's important to remember that with prompt treatment, these severe complications are uncommon. Most children go on to live perfectly healthy, active lives. Living with the aftermath of Kawasaki disease can be stressful for parents. It's natural to worry about your child's future health. The key is to stay proactive. Follow the doctor's recommendations for medication and follow-up appointments diligently. Encourage a heart-healthy lifestyle for your child as they grow up, including a balanced diet and regular physical activity. Also, make sure that any future doctors or healthcare providers your child sees are aware of their history of Kawasaki disease. This information is important for their lifelong medical record. It's also important for parents to find support. Connecting with other families who have gone through a similar experience can be incredibly helpful. There are online support groups and foundations dedicated to Kawasaki disease that provide valuable resources and a sense of community. Remember, you are not alone in this journey. To wrap things up, Kawasaki disease is a serious condition, but it's manageable. The most important takeaway is to be vigilant about the symptoms. A persistent high fever for 5 days or more, combined with red eyes, a rash, red or swollen hands and feet, cracked lips, and a strawberry tongue, are all red flags that require immediate medical attention. Don't hesitate to contact your pediatrician or go to the emergency room if you're concerned. Early diagnosis and treatment with IVIG and aspirin are the keys to preventing heart complications and ensuring a full recovery for your child. While the cause remains a mystery, modern medicine has given us effective tools to fight it. By staying informed and acting quickly, you can protect your child and give them the best possible chance at a healthy future. As a parent or caregiver, what can you do? The most important thing is to be vigilant. Never ignore a prolonged fever in a young child. If your child has a fever that lasts for several days, especially if it's accompanied by any of the other symptoms like red eyes, a rash, or cracked lips, seek medical attention immediately. quick action can prevent serious complications and make all the difference in the outcome. Currently, there is no known way to prevent Kawasaki disease. Since we don't know the exact cause, we can't vaccinate against it or avoid a specific trigger. Therefore, our best and only defense is early recognition. Spreading awareness among parents, teachers, and healthcare providers is crucial for improving outcomes and protecting young hearts from this silent threat. Kawasaki disease is rare, but it is also serious and potentially life-threatening. Early diagnosis saves lives. Remember, a fever that just won't go away is your child's cry for help. Listening to that cry and acting on it in time can save their future. For so many children, early care means a second chance at a healthy, active life. But for those where diagnosis is delayed, the illness can leave scars on the heart that last forever. Please note, this content is for general informational purposes only and is not a substitute for professional medical advice. If you are concerned about your child's health, always consult a qualified healthcare professional. Thank you for watching Asian Watch. If you found this information helpful, please like, share, and subscribe for more awareness videos.